Performance testing AI in healthcare often starts with two familiar metrics: sensitivity and specificity. They show up in papers, dashboards, and vendor brochures. But in hospitals, these numbers only tell part of the story. To understand how an AI system will actually behave in your patient population, you'll also need at least two more metrics: positive predictive value and negative predictive value, or PPV and NPV. Hi, I'm Shuaib, medical physicist and CEO at Newton's Tree. In this video, I'm going to explain what sensitivity, specificity, PPV, and NPV really mean, how they work together, and how they help you understand both technical performance and real-world clinical impact. Let us begin. Sensitivity tells you, of all the patients who truly have the condition, how many the AI correctly detects. High sensitivity means fewer misdiagnoses. This is essential for safety-focused tasks like sepsis alerts, or pneumothorax detection, or cancer screening. But sensitivity has a limitation. It doesn't tell you anything about false positives or whether an alert is trustworthy. Specificity tells you, of all the patients who do not have the condition, how many the AI correctly ignores. High specificity means fewer false alarms and less alert fatigue. But specificity also has a limitation. You can have excellent specificity but still miss dangerous cases if your sensitivity is low. So sensitivity and specificity complement each other, but they share a bigger issue. They do not change with disease prevalence. Now, this is important. Sensitivity and specificity describe the model's intrinsic technical ability, but they do not tell you what happens when you deploy the model in your hospital with your patients and your case mix. In rare conditions like pulmonary embolism or pediatric stroke, you could have 95% sensitivity and 95% specificity and still find that most positive alerts are wrong. This is why hospitals need PPV and NPV. PPV answers a question that is far more meaningful for clinicians. When the AI says positive, how likely is that result to be true? PPV depends heavily on local prevalence. In conditions that are rare, PPV often drops sharply even when sensitivity and specificity look excellent. And PPV matters because it determines how many alerts clinicians can trust, how many false positives must be reviewed, and how much workload the AI will generate, and ultimately whether the AI improves patient care. NPV answers the opposite question. When the AI says negative, how confident can we be that this is actually correct? NPV also depends on prevalence. In high prevalence settings, NPV can fall even if the model looks strong on paper. NPV affects triage, safe discharge decisions, follow-up planning, and operational risk. And just like PPV, NPV changes depending on your population, not the vendor test dataset. So here is the complete picture. Sensitivity and specificity tell you how well the model performs in principle. They describe its technical capability independent of prevalence. PPV and NPV tell you how well the model performs in practice. They describe how trustworthy the results are in your institution, based on your patient population and the disease prevalence. Or put another way, sensitivity and specificity describe the model's technical performance, PPV and NPV describe its clinical performance. And you need all four metrics to evaluate AI safely. Now, there are some common pitfalls to avoid. Do not rely on sensitivity or specificity alone. Try not to compare metrics across datasets with different prevalence. Do not assume vendor thresholds will work for your population. Don't judge models based on accuracy alone. And never deploy without understanding the false positive burden. To summarize in plain words, sensitivity tells you how well the AI finds true cases, specificity tells you how well it avoids false alarms, positive predictive value tells you how often a positive alert is correct in your population, and negative predictive value tells you how often a negative result is trustworthy in your population. If this video helped clarify these concepts, please like, subscribe, share, and drop a comment. And if your health system is ready to evaluate AI under real clinical conditions, Newton's Tree works with hospitals to select, test, deploy, and monitor AI safely and effectively. Thank you for watching, and we'll see you in the next one.